I mean, is it started or? Okay. Hi everyone, I'm Dr. Piyusha Majumdar, and today I'm with the host of SheTalk, Kusum KC, and I'm really happy to be here because somebody has come to ask about me and what kind of a work I do. So I'm really excited for it.
Hello everyone, welcome to you in SheTalks. It's me Kusum KC, and today I have a guest, Dr. Piyusha Majumdar ma'am. She has been working for almost around 2 decades in the field of public health and implementation research. I would like to welcome Dr. Piyusha ma'am. Welcome to you ma'am.
Thank you so much, Kusum.
Okay, in the SheTalk program, we'll be discussing about life-related experience, unfolded stories, and health and well-being. So I would like to jump in the segment. There are altogether 5 segments in the SheTalk show. So in the first segment, we'll be talking about happiness talk. Dr. Piyusha ma'am, how is life going on?
Life is going on great these days, and for me, I go to my college, teach my students, and having been born on Teachers' Day, the presence of students really made me happy. So life is going on great. I am an associate professor at IIHMR University, and I'm also the program coordinator for one of the prestigious program, MPH, in the area of implementation science. So IIHMR has started this program since last 3 years, and we have been given grant from WHA to impart the training on implementation research for LMIC.
Okay ma'am, then are you being happy being a woman?
Yes, I think I'm happy being a woman, because when we talk about the women, she's the powerhouse. Women, she has the power, she has the resilience, and she can nurture and create the things. Women symbolizes in Hinduism, women symbolizes Durga Ma, Saraswati Ma, and the deities that give power. So I think I'm happy being a woman, but in some places I think women are the most vulnerable population, and they face a lot of challenges. But I think I'm being born and raised in a family where our parents treated us like the sons. So I think I'm happy being a woman.
Okay, nice ma'am, it's very amazing. So now I would like to jump to the another segment. Here we'll be talking about real talk. We'll be talking about your childhood interest and how you came up to research field, from your journey from your childhood to research field. I want to hear more about you.
Okay, talking about my childhood and my education. So I was born in Delhi, and I did my schooling and my college from Delhi only. I was a scholar, and during my school time I was a bright student in the class, taken part in all the extracurricular activities. Sometimes my sister used to call me that you are a teacher's pet. And so my parents during my childhood, my parents supported me a lot, and they feel happy when I took part in inter-school competitions, won prizes. And I was very interested in science field when I was a kid, And I remember one one of the instance when I was going to I was going to my father's office, and I saw a WHO building there. And I asked my father that, Papa, what is this building? I really like this building. And he told me that this is WHO, World Health Organization, and they takes care of the health of the people. So I thought that, wow, this is great. One day I would definitely like to work for WHO, and now I feel proud that yes, I am working for WHO, and I am working in the area of public health and implementation research. So as I said that I was really interested in science field, and I aspired to become a doctor one day. And after doing my schooling, high school, I applied in various medical colleges, but due to some reason I couldn't get through it. So I decided, my mother said, you can always be a doctor by doing certain other things. So I started my journey by doing a graduation in the life sciences field, and the research always interests me. So while doing my graduation, I found that there is an area of public health, and and this area of public health actually doing something for the community. So so I decided to take admission in Masters in Anthropology course. So when I took admission in Masters in Anthropology course in Delhi University, we had our tie-up with various medical college. So after at the time of my post-graduation, I got the chance to work in INCLIN organization that deals mainly with that is the International Clinical Epidemiological Network. I got the chance to work with Dr. N.K. Arora. I was associated with a medical college in Lady Harding Medical College. I worked for one of their projects. So during my internship, I got the chance to work in their project, which is on evaluation of universal immunization program in India. And that is how my journey of public health started. Okay. And after doing that, I got associated with ICMR, Indian Council of Medical Research. It's a project. So that is how my journey started in the area of public health, and my interest developed. Then I finally decided that, that I'll be doing my masters, and I'll definitely be doing my PhD in the area of public health. So that is how my journey started.
Okay, thank you, ma'am, and it's very amazing to learn more about your experience, and you have been involved in many more projects, and you also said that you have been engaged, how you engage in WHO and the grants. So I want to hear, how would you like to remember the moment when the grants is approval from WHO for this project? Would you like to remember that moment?
Oh my, definitely. When we first thing, when we received this information that we got this grant from WHO TDR, it was ecstatic movement for us. We really we were hopeful that we will get this grant, but obviously so we were so excited with joy when we come to know that we are a part of this program. And there are many factors that are responsible for getting this grant from WHO. We were a part of a STRIPE program where the other country partners like UGM, University of Gajah Mada, Indonesia, and BRAC University, they were also there. And the Johns Hopkins, the Johns Hopkins country partner and the representative were also a part of WHO TDR. So, we already had our network established, and by looking at, IHMR's profile, we got this grant from WHO. So it was an aha moment for us, and also, a greater responsibility as well.
Yes, and hard work pays a lot, and your childhood dream that one day you talk with.
Yes, definitely. It was an aha moment because my childhood dream was to work for WHO, and when this happened, I thought that, okay, my dream has now come true because I'm working for WHO now.
It takes 10 years or 20 years? Around?
Yeah, it takes around 10 to 15 years.
Oh my God, in a very short period, from childhood dream to it came into real field. Now I would like to jump in the third segment, which is behind the scene talk. It is one of the main component of this SheTalks show. So we'll be talking more about your story, her story. So you have involved in so many programs, health related program. What might be the challenges being a woman you face doing in the project? Any of the incident or moment you want to share working in health sector, women health sector?
Okay, by working as a woman in a health sector, I think there are a lot of challenges, because when we talk about leadership, there are very less say about women, and being a society in which always male is celebrated and a patriarchal society, I think in healthcare field, though most of the things are being done by the female, when it comes to female, whether we talk about A&M, whether we talk about ASHA, whether we talk about any frontline worker, they all are female. But when it comes to the leadership, we have seen that there are very less women who reach up to that level. So there are certain barriers, there are certain glass ceiling that exist for women to reach the top.
Would you like to remember some of the stories of the field? If any of the interesting story which make you think much more on developing the grants or writing proposal?
Okay, yeah. See, being a woman, and being a researcher myself, I was always interested in working, on the research which is related to women. I was always interested in working for the women who are vulnerable. So there was a time when I also worked in my research, which is related with one of the vulnerable population, which is female injecting drug users. So if I remember, and the time when I was collecting the data, I know the challenges which is being faced by these women, what kind of a stigma that has existed for these women. So I think I always wanted to do some research work that will help in the policy development for this vulnerable group. I'm also doing, as a part of my, in my one of my PhD students, so I had asked him to work on female sex workers, because we know that vulnerability exists among these people more. So there should be adequate research, especially on the well-being of these women, especially on the health status of these women, so that the policies can be formed. And being an academician, we can uplift their status, we can work for their improvement in their health. Through the academic mode only. So I think I'll be writing much more grant on improving the health status of the vulnerable women, especially female sex workers or female injecting drug users.
Nice to hear, ma'am. Any of the turning moment from research science field to focus on women health? Any of your life-related turning moment which makes you like choosing women health sector?
Okay, so that question led me, going back to the memory lane. So I wanted to share you one story, the struggle that I faced. I had a very, when I talk about my childhood, I had a very comfortable childhood. As I said earlier, that our parents, I think I can see them, the parent who always treated us like our son. We are two sisters only.
Okay.
And I got shattered when I lost my father at a very early age. So then what actual life is, then I got to know the meaning of what actual life is, because after losing your father, you have to face many challenges. First is the financial challenge that a person faces. Second is the emotional challenge that a person, emotional challenge that a family face. There are certain societal barrier also when you have. So we are two daughters of my parents, and I know my mother being an extremely strong woman, and she gave us so much of strength. And because at that time, even traveling to other places, it was not that easy. But my mother always, she inspired us, and she has that trust on us, that she said, yes, you will do whatever you want, you can go whatever you want, and you can do whatever you want. I think that is the thing. And so having from that environment where where we face some challenge after losing our father, so I had always something in my mind that yes, we can do. During our society side, we also face certain challenges, because they were like, they are the girls, let them get married early. So I said no, definitely no. We wanted to do something. I wanted to make my parents proud, and then I'll do something. So after doing my masters, my mother said that if you wanted to do PhD, you must do. And that is how I said that let me do my higher education first, and then I'll do marriage. And I also wanted to talk about my husband, because my husband supported me in he supported me in any which way he can, and that is the main reason I have been able to achieve my goals, have been able to achieve my dreams here.
Okay, hats up to your mother and your husband. Knowing your story, how the men's engagement for supporting the women education, and after getting married, even in the South Asian region, Nepal, India have similar problem like early marriage. It can be the hindrance for the women for higher education. So you want to take those people as your mentor, or you want to take this portion like mother, husband, these people?
Definitely. I think a family's role is extremely important in the progress of a girl, a progress of a woman. So a family has a main role to play. If you have the family who's supporting, a family who abide by your decision, a family who approves your decision, so I think that is very important. And not only your mother or your father or your husband, but also because in Southeast, when we talk about the Southeast Asia, so we have a strong relationship values. So it's not only about the family of a girl, but also the family of a husband who has to be supportive. So I think in my case, it's my husband's family also. They are very supportive, and and they always want me to do to reach for my dreams, and that is why I'm doing that.
It's really inspiring. Now I'd like to jump in the another segment, fourth segment. We'll be talking about health talk. So in this part, what are the major three health priority do you want to give for better health and well-being yourself in daily life?
Okay, so if we talk about the well-being, there are three parameters for that. One is the physical, second one is the social, and third one is the mental. So talking about the physical well-being, I think we should take care of our body. We should take nutritious food. And talking about the mental well-being, we should be practicing yoga, mindfulness. And talking about the emotional well-being, I think we should be positive, and we should refrain ourselves from the negative things. And these days, I think a digital detoxing is also very necessary to take care of our well-being. These days, youth are they are so much of engrossed in the social media. I think there's some kind of a digital detoxing is necessary. And there's a line that says that FOMO, people have FOMO. I think we should FOMO means fear of missing out. I think we should also accept that there is a JOMO, that is joy of missing out. So sometimes we need a digital detox and experience this joy of missing out in order to improve our well-being.
Okay, ma'am. And Dr. Piyusha, ma'am, being a mother, and you have engaged in different organization, different initiatives. Mostly you want creativity and engage in many more small initiatives also. And you also a professor in one of the reputed university. So how easy to balance personal life and professional life?
Yeah, that's a that's a very good question. I think if I talk about my engagement, so being a professor, I'm also engaged in besides teaching, I'm also engaged in giving trainings, managing management development programs at IIHMR universities. My involvement in the research work also, it's there. So I'm also a part of another grant that is being granted by ICSSR, Indian Council of Social Science Research, and there we are working towards the reproductive and sexual health of a women. And beside this, I'm also a podcaster. We have our Ensure Health podcast. We have received a grant from TIPH, or this is public health, supported by Association and Schools and Programs of Public Health at USA. So we got this grant, and as a part of this grant, we have developed our own podcast, which is available by the name of Ensure Health, in which we deep dive in the health topics, and we interview or talk with the experts. So these are the few other things where I am engaged. I'm also a part of CCIS, which is a Consortium of Cancer and Implementation Science. So I'm a member of their action group, which talks about implementation science and global health. And we are working towards creating advocacy programs, and as well as we are creating some knowledge product in the area of implementation science there. So I know that it's very challenging having a baby, and my son, he's 13-year-old, and so it's really sometimes I find that this is a challenging to keep a work-life balance is very, very important. So I think it's very important, and sometimes I miss doing it. But my suggestion is that we should have a better work-life balance. If there are weekends for you, then you should actually engage, with your family here rather than focusing. So there is a kind of it's required that you should have adequate time for your family also, and I try to do so because I'm here at Jaipur. I was in Delhi, and the reason for me to come to Jaipur is this: that I should be able to give time to my family. I should be able to give time to my kid, my husband, and I think in Jaipur I have been able to do so because we do not have much traveling here as compared to Delhi. In the end, I would like to say that a better environment, a conducive environment is necessary for having a healthy work-life balance, and IIHMR is the best place to work. And when I shifted to IIHMR, I have the best work-life balance here. Thank you so much.
Yes, you are a great lady, no doubt.